Hi. So I will answer the questions that have been put up in the group and also wait for the answer on the question that I had put up to the group. Unfortunately, nobody has answered this very fundamental question. I think it is better to start studying this disorder if you really want to get some insight and put it into practice. So, the first question that I see in the group is diabetes reversible? And then there is a similar question, what is the difference between controlling diabetes and reversing diabetes? And then there is a third question, what is the difference between reversal and remission of diabetes? So three very closely connected questions. So the first question is, how do we understand the phenomena of reversal of diabetes? So, what is reversal of diabetes? When we talk of reversal of diabetes, we are talking about reversing the faulty glucose metabolism, the faulty carbohydrate metabolism, and eventually uh, reversing the metabolic impact of this flawed carbohydrate mechanism. This is reversal. Then, when it comes to what is remission, when we talk of remission of diabetes, we are basically talking about a complete reduction of all the oral hypoglycemic agents, if any, that the patient is taking. Along with this, a normal glucose tolerance curve for at least 3 months. This is remission. That means the disease has gone into remission. This is the difference between remission and reversal. And when we are talking about the possibility of reversal, yes, diabetes is now a proven diabetes. When I'm talking of diabetes, I'm talking of diabetes type 2 only. Type 2 is a proven reversible disease. In some cases, even remission can happen. To what extent a reversal will happen and to what extent the remission will happen depends on several factors and varies from case to case. More we learn about this aspect during our webinar that is going to be held end of November and first week of December. The other question is, I'm very confused about repetization, potency selection. I believe whoever has asked this question, the confusion is less related to diabetes, it is more related to the basic fundamentals of homeopathic repetization and homeopathic posology and selection of the remedy. And so more questions, how homeopathy has an edge over allopathy, and as we have to give patient reason to switch over to homeopathy for diabetes. Dr. Shailendra Singh has asked. He has also asked, do we have something in diabetes that can prevent? And I have read that giving constitutional remedies, this can be achieved. So let me take up the second part first. The second part is this idea of constitutional remedy preventing diabetes. In my understanding, this whole idea of constitutional remedy, being the solution for everything that you are suffering from or you will suffer from. Almost it is said that if you take constitutional remedy properly, then you will almost become immortal. Is complete nonsense in my understanding. Constitutional remedy is good, but I do not make any claims of its ability to prevent diabetes or to even extend your life span. So it's a very, very limited concept of homeopathy if we do this. So please don't have all these wrong notions about so-called constitutional remedy. Hahnemann never prescribed something called constitutional remedy. Kant himself never prescribed something called constitutional remedy the way we understand it. So it is better that this is all play of words. Let's come down to very basic, simple fact that indicated remedy for the patient in that point of time is what is required to help the patient. Then also, homeopathy has an edge over allopathy. We have to give reasons. So let me try and tell you, in my clinic, I see diabetes as a disease that requires an integrated care. When I talk of integrated care, it means each system, whether it is allopathy, it is homeopathy, it is exercise science, it is nutrition, has its own niche. One patient usually will require all of these. Early stages, it may not require allopathic medicines, and if the patient is compliant with lifestyle changes, for many, many years, in fact more than a decade also, the patient can remain without any kind of allopathic medications. While I say this, I am extremely cautious. It means that the patient is monitoring his sugars and metabolic impact of his sugars very, very regularly. So I see this instead of one over the other. I see this where we can join hands with other sciences and add value and quality of life in our patient. So let's not get into this idea of one is superior to the other. Yes, in many areas, homeopathy can certainly achieve what allopathic science is not able to achieve. But I am always of this opinion that there are several areas that homeopathy also has a big lacuna in, and where allopathy is playing a wonderful role. And last question I will take for the day, because the video will become too long. So Dr. Sachin Shah has put this question: is homeopathic approach to diabetes very different in regards to case taking, totality formation as compared to other diseases? Well, in a way, every case taking, every totality formation, every posology remedy selection in any disease, including diabetes, depends upon how you understand the disease per se, how you understand what are the causative factors, how you understand what are the phases of the disease, what are the stages of the disease, and the totality will therefore change, and also your case taking will change accordingly. So as I understand, there is nothing very different about diabetes in terms of its case taking or its remedy selection or totality formation. It evolves as you understand the disease better. So much so for today, and tomorrow again I will answer some more questions. Meantime, enjoy this video, share this video, and do enroll for this decluttering diabetes, which is going to be held in last week of November and first week of December.